Um, so can you tell me some details about you? For example, your age?
Mm-hmm. I'm 21 years old.
21 and...
No, sorry, I'm 22.
Okay.
It's been a while.
Okay, so how about your education background?
Mm-hmm. Highest level of attainment would be HSC, Year 12, currently in 5th year of software engineering at Sydney University.
Okay, and so you're currently just a student and not any other job or something?
Oh yeah, right now I make mattresses at a natural bedding company, 3 days a week.
Oh, so it's like a part-time job?
Yeah.
Okay.
Yeah.
Okay, let's talk about your medical experience. So you told me you had your ankle had injured.
Mm-hmm.
So how did that happen?
Happened a bunch of times. Once I was playing basketball, rolled my ankle really badly.
Okay.
And then a few times after that, I was doing some martial arts stuff and I rolled my ankle a lot of times until it tore completely.
So it's like the joint just fell off?
Yeah, calcaneofibular ligament tore off.
Okay, so when that thing happened, how did you get the medical help?
First, I went to a physiotherapist.
By yourself?
Yes.
Okay.
Yeah, I did. Yes.
How did you get the one foot jumping?
Oh, like walking to physio.
Oh, so it's not that so.
Yeah, I could still walk, but
Okay.
it'd pop out sometimes.
Oh, okay. So how long did it take to fully healed?
Once I got surgery, it was 2 weeks in a cast.
In the cast?
Yeah. What's the word?
Oh yeah.
Yeah, those things.
I know.
Wrapping thingy. And then I think it was 6 whole months of not doing...
6 whole months?
Yeah, I couldn't run for 6 months.
So it's like for whole 6 months you are like not able to walk like normal?
Yeah, you can walk pretty normally, but you can't do real exercise.
Oh, so
for like 6 months.
Was there any period that you are not able to walk?
Yeah, 2 weeks when I was in cast, I had to use crutches.
Oh, so that thing is scratches?
Crutches.
Crutches, okay.
Yeah.
Okay. So during these 2 weeks, were you taken care of anyone?
By anyone?
By anyone?
I guess my parents would help me.
Your parents. So it's like they took care of you for like 2 weeks.
Yeah. So I was just sitting on a couch at home. They had to make food for me and all that.
Okay, so during your experience being taken care, so was there any conflict with you and your parents?
Yeah, a little bit.
So the most unforgettable one is like...
Mostly, I don't like people doing things for me. So I would want to cook my own food sometimes. So I'd walk my crutches up to the stove and try and cook, and they'd be like, sit down, we'll make you food instead. But it's not like big conflicts or anything.
But if you wanted to go to any place, so you move it to yourselves, or they push you to there?
I can walk. Yeah, with my crutches I can walk anywhere.
So they just their mainly job is like cook for you, or...
Yeah, and drive me places.
So during that time, can I say your emotion would be a little depressed or just normal?
Yeah, I was fairly depressed.
Mainly on what thing?
Because I couldn't exercise or go outside and
so you really
do
like
fun things.
Exercise or something?
Yeah.
So when you felt depressed, what did you do? Or to express or to deal with it?
I ate junk food.
Junk food?
Yeah.
Okay.
And yeah, played video games, old video games. That's all I could do.
So you don't like, so did, you didn't like having much conversation with your parents, or just normal, like before?
Yeah, just normal.
Just
yeah.
normal. Not exactly, not very less than before, or just normal?
Same, yeah.
Okay, same. So during that time, was there anything you became particularly sensitive with?
Okay. Not really.
Okay.
Yeah.
So so because not, you were not being the like normal person during that time. So did you find anything that you didn't notice before? For example, something that helped you a lot, or something that make you feel very depressed if you were in that situation?
Mm-hmm. Think about that one. Maybe example of that one. What do you mean exactly?
Yeah, maybe you find something really not accessible when you were injured, but when you are a normal person, you don't feel like there's anything wrong with that.
Okay.
For example, the stairs or something.
Well, yeah, there was the one time I trying to find somewhere to sit at university is pretty hard when you've got a cast on, because you need to keep it dry and stuff. So I tried going to ISL, International Student Lounge.
Okay.
And I'm sitting there and waiting for my mum to pick me up, and the guys, one of the societies, had to kick me out because it was too late. So I had to crutch my way down the stairs and sit in front of Herman's, which is kind of lame.
So it's not like some how to say that, because you know some paths are for disabled
Oh
people.
yeah.
There were not.
There's an elevator, isn't there?
Oh, okay.
Yeah, I didn't think to use the elevators because I'm not used to using elevators.
So because it's like for just that time, you didn't realize something that could help you.
Yeah, because temporary.
Yeah,
you don't think about
I understand. So, how about during the surgery? So it's like you had that surgery, and when can you get out of the, how to say that? Just sorry. After your surgery, how long can you go home before?
Yeah, it was pretty much straight away.
Yeah.
You like wake up. They you wake up, you get a little bit of food, they check your blood pressure and all that, and then they get you to stand up with crutches. You do the process of walking upstairs just to show that you can do it with crutches on, and then I got wheeled out, put in the car, went straight home.
Oh, so it's like in just the day after you get the surgery. So did you have much conversation with nurse or doctors or something?
Honestly, not much. No. It was very quick. The only conversation with doctor was like just before it, when I'm laying in the bed, and they give you the, you know how they give you 2 injections? They give you one to make you a little bit sleepy, and they give you the real one. So like just after they did that one, the doctor comes in and says hi, and then afterwards he comes back to just check and say, yeah, doing good.
Oh, so not other conversation actually.
Nah, it was pretty in and out.
So later, maybe you needed to check for several times or something. Check for your wounded place.
Yeah, it was really really well done. Like, I didn't have any problems with it. All I had to do was go to a physio a few weeks later, get checked out, and I think I got it checked once.
Okay.
And then I went just to physio to do rehab stuff.
So, do you think it's quite easy to go to the doctor in Australia?
For elective surgery, yes.
Elective surgery.
Yeah.
So for what is
the alternative being like emergencies? I don't know much about having emergency surgeries.
Okay. Okay. Another question is, have you ever taken care of any other patients?
Ah, I mean, I helped my dad a little bit a few months ago. He got a knee reconstruction.
Knee reconstruction.
Reconstruction. He
Oh,
got some metal put in his knees to make it work better.
so it's like a little serious one, right? A really
Yeah.
serious one.
Sort of, yeah.
So-
Meaning he couldn't walk if he didn't get it eventually.
So, how long have you taken care of him?
He recovered pretty quickly. He was, it was maybe a month or so, where I'd have to drive him places, and yeah, he could walk pretty quickly as well with that one.
So, how did you get along with him during that period? Is there any particular thing that happened not that normal? Because you know sometimes patient can really have a bad temper or something.
No, I think it was good. He was actually, yeah, it was much,
Normal.
yeah, it was good.
Okay. How about your another experience in hospital? I'm sorry, I forgot.
Oh,
What's
yeah.
that?
Before that one, I got wisdom teeth done.
Wisdom teeth.
Yeah. So I got 4 teeth removed from the sides of my mouth. That was also really easy because it was private hospital.
So it's just pull out and then done.
Yeah, I would fully what's the word? Anesthetic. General anesthetic. So I went to sleep, and then woke up, no teeth.
Okay.
Easy.
So it's like you were sleepy and then
Yeah, yeah. You go to sleep.
they just pull out the 4 teeth at the same time.
Yeah,
Wow.
yeah. They break them. They don't just pull them out. They drill into them and sort of smash them up and take their little bits out, piece by piece. And they sew it all back together.
Okay.
Yeah.
Okay. Yeah, I think. Yeah, we're done. Maybe.
Cool.
Yeah. Sorry.
Yeah, no,
Because. Yeah.